Hello and welcome. Today, we're diving deep into a less common but important topic: ureteral tumors. We'll explore what they are, how they develop, and the options available for treatment. Understanding this condition is crucial for early detection and effective management. The exact cause of ureteral tumors remains somewhat unclear, but several risk factors have been identified. Tobacco smoking is a significant contributor, as carcinogens in smoke can be absorbed and excreted through the urinary system. Exposure to certain chemicals in the workplace, such as aromatic amines used in the dye, rubber, and textile industries, increases the risk. Chronic inflammation or irritation of the ureter, often caused by recurrent urinary tract infections or kidney stones, may also play a role. Finally, a history of bladder cancer is a known risk factor, as these cancers can sometimes spread to the ureters. Ureteral tumors typically arise from the lining of the ureter, known as the urothelium. As the tumor grows, it can obstruct the flow of urine, leading to hydronephrosis, a swelling of the kidney due to urine back up. This obstruction can damage the kidney over time. The tumor cells can also invade the deeper layers of the ureteral wall, potentially spreading to nearby lymph nodes or other organs. The pathophysiology depends on the grade and stage of the tumor, which determine its aggressiveness and extent of spread. High-grade tumors are more likely to be aggressive and spread rapidly. Ureteral tumors are relatively rare, accounting for only a small percentage of all urological cancers. They are more common in older adults, typically between the ages of 60 and 80. Men are affected more frequently than women. While exact global statistics vary, the incidence is generally higher in industrialized countries, possibly due to increased exposure to risk factors like smoking and industrial chemicals. The symptoms of ureteral tumors can be subtle and easily mistaken for other conditions. The most common symptom is hematuria, or blood in the urine, which may be intermittent. Flank pain, or pain in the side, can occur due to ureteral obstruction and hydronephrosis. Some individuals may experience urinary frequency or urgency, similar to a urinary tract infection. In advanced stages, symptoms may include weight loss, fatigue, and bone pain if the cancer has spread. Diagnosing ureteral tumors often involves a combination of imaging and endoscopic procedures. A urine cytology test can detect abnormal cells in the urine. A CT urogram is a specialized CT scan that provides detailed images of the urinary tract. Ureteroscopy, a procedure where a small camera is inserted into the ureter, allows for direct visualization of the tumor in biopsy. A biopsy is essential for confirming the diagnosis and determining the type and grade of the tumor. Ureteral tumors are classified based on their microscopic appearance, grade, and stage. The most common type is urothelial carcinoma, also known as transitional cell carcinoma. The grade refers to how abnormal the cells look under a microscope, with higher grades indicating more aggressive tumors. Staging describes the extent of the tumor's spread from localized to distant metastasis. Staging is usually defined using the TM system: a tumor, node, metastasis. The treatment of ureteral tumors depends on several factors, including the tumor's size, location, grade, and stage, as well as the patient's overall health. For small, low-grade tumors, a ureteroscopic resection may be possible. This involves removing the tumor using instruments inserted through the ureteroscope. For larger or more aggressive tumors, a radical nephrotorectomy may be necessary. This is a surgical procedure that involves removing the entire kidney and ureter, along with a portion of the bladder cuff. In some cases, chemotherapy or immunotherapy may be used to treat advanced disease or to reduce the risk of recurrence. While there's no guaranteed way to prevent ureteral tumors, adopting a healthy lifestyle can significantly reduce the risk. Quitting smoking is the most important step you can take. If you work with industrial chemicals, follow all safety protocols and use appropriate protective equipment. Maintaining a healthy weight and staying hydrated can also be beneficial. Regular medical check-ups and prompt treatment of urinary tract infections can help detect any problems early. The prognosis for ureteral tumors varies depending on the stage and grade of the cancer at diagnosis. Early stage, low-grade tumors have a good prognosis with high survival rates. However, advanced stage tumors are more challenging to treat and have a lower survival rate. Recent research is focused on developing new targeted therapies and immunotherapies to improve outcomes for patients with advanced ureteral tumors. Researchers are also exploring biomarkers that can help predict treatment response and identify patients who are at higher risk of recurrence. Advancements in minimally invasive surgical techniques are also improving patient outcomes and reducing recovery times.